name is Carolyn, and I'm gonna be your nurse today. Let me just go ahead, wash my hands. Can you verify your name and date of birth for me?
Jessica Connor, 1786,
Okay, Jessica, do you know where you are?
General Hospital,
Do you know who's the president?
Donald Trump,
All right, do you know what day is today?
Thursday.
Okay, my patient is alert and oriented ×4. Jessica, today we're gonna be doing a head to toe examination. It involves me touching, feeling, listening, and tapping. Okay, is that okay with you?
Yes.
Part of this examination is gonna entail me also removing part of your clothes. Is that okay with you?
Yes.
But don't you worry, I'm gonna get you all covered, okay?
Alright.
Alright, so let's make sure that the room is, the lighting is good. The light is good. Alright, we're gonna provide some privacy, Jessica. Alright, okay, are you okay?
Yes.
You ready to get started?
Yes.
Alright, let's go, let me hold you. Alright, so Jessica, we're gonna start with your, height and weight, okay? And, okay, I see Jessica, you're 5'2", and you are 135 pounds with a BMI of 21. Let me put you back. Okay. Alright, so we're gonna start with your vital signs. Okay, your temperature is fine, your heart rate is normal, your blood pressure seems okay, it's within normal range. And, alright, so when I walked in the room today, I noticed you smiling, and your affect is good, your mood is fine, you dressed appropriately, you're answering my questions appropriately. So we're gonna proceed with the examination, and I'm gonna start with inspection. I'm gonna inspect your head and your face, and right now I'm looking for any color discoloration. I'm looking for any rashes, any lesions, and I don't see any of those. So I'm gonna put on my gloves. Alright, so Jessica, I'm gonna look in your head, is that okay?
Yes.
Alright, so we're inspecting and we're palpating, and we're looking for the texture of the hair, we're looking for any patches, we're looking for any patches. We're looking for any infestations, we don't see any, and I'm looking for size, any masses, let me check. No masses. Alright. Okay, Jessica. Alright, so I'm looking at your face, and I'm looking for any discoloration. We already said that. Alright, so we're gonna look and palpate the temporal artery. And can you clench your teeth for me? Alright, can you and do Alright, and there's no clicking or clenching, and alright, so now we're gonna look at inspecting your eyes, and I'm looking at the external eyes. I'm looking also at your eyebrows, I'm looking at your eyelids, I'm looking at your sclera, and that's nice and white, and I'm gonna palpate your maxilla, your sinuses, maxillary, and frontal. Do you feel any pain?
No.
Alright, no pain. Alright, so now I'm gonna look in your eyes. So Jessica's eyes, pupils is equal, round, reactive to light and accommodation. Alright, so can you look up, Jessica? Her conjunctiva is nice and pink. Alright, so now we're gonna inspect the nose, and we're looking for any deviated septum. I don't see any abnormalities, no rash, no scars, nothing. Alright, so now I'm gonna palpate. Do you feel any pain?
No.
Okay, no pain. Alright. So Jessica, now I'm gonna ask that you hold your nostril one side, blow, the other side, blow. Any problems with that?
No.
No problems? Alright, Jessica. So now we're gonna do your sense of smell. Alright, close your eyes. You're gonna tell me what you smell, okay?
Alcohol.
Alright, very good. Alright, so now I'm gonna look in your nose. Alright. No abnormalities noted. Alright, Jessica. Alright, so now I'm gonna do your ear. Okay, so I'm gonna palpate the external ear. You feel any pain?
No.
You feel any pain?
No.
Alright, any problems with your hearing?
No.
No? Alright, I'm gonna palpate the mastoid process. Do you feel any pain?
No.
No tenderness?
No.
Alright, no redness noted? No redness? No pain?
No.
Alright. Alright, so now we're gonna do the whisker test. Alright, so tell me what you hear, right? Repeat what
Okay.
you heard.
Apple. 1, 2, 3, 4.
Alright, very good, Jessica. So now I'm gonna do the Weber and the Renee test. I'm gonna tap on this and I'm gonna put it on the top of your head and you're
Yeah.
gonna tell me if you hear the same in both
Okay.
ears, okay?
Yes.
Alright. Tell me when the sound disappears, okay?
It's gone.
You still hear it?
No. It's gone.
You still hear it?
No.
Alright. Okay, so now we're gonna assess your sense of touch. So you can close your eyes and you just tell me where you feel this, okay?
Forehead. Left cheek. Right cheek. Chin. Nose.
Alright, very good, Jessica. Alright, so now we're gonna do your sense of hot and cold. And I'm gonna put one hot, one cold. You just tell me if it's hot or cold, okay?
Okay.
And where do you feel it?
Okay. Cold.
In your arm?
Yep.
Alright.
Hot.
Okay.
Cold.
Alright, very good, Jessica. Now, I'm gonna put this object on you. This is basically for your sense also of touch, and it's gonna be a sharp and dull sense of pain.
Okay.
Alright, sense of pain. So this is
Sharp.
dull. I'm gonna tell you first. This is dull. This is sharp. So you tell me what you feel, okay?
Okay. Sharp. Dull. Sharp. Dull.
Alright, thank you, Jessica. Alright. And also, this, you tell me what you, so close your eyes, and you're gonna tell me what object is in your hand, okay?
Okay. Keys.
Alright, very good. Alright. Alright, so now we're gonna go on to Jessica's mouth. We're gonna inspect the outer mouth. First, we're looking at the lips. We're looking for any cyanosis. We're looking for any dryness. And we're looking for any lesions, and we don't see any. And so now, I'm gonna put on my gloves. Alright, so I'm gonna open your mouth for me, Jessica, please. Alright. Okay, I'm looking for any masses, any lesions, any discoloration. Raise your tongue to the roof of your mouth, please. Alright, do you feel any pain there?
No.
No pain? Alright. Okay. Then I'm gonna check your uvula, make sure everything is okay with that. Gag reflexes. The uvula move up and down, that's normal. Alright. Your sense of, did you swallow? Right? Alright, she's swallowing okay, so that
Yes.
cranial nerve is intact. Alright. Alright, so Jessica, now we're gonna move to your neck. Right, I'm inspecting for any lesions, any color, any rashes, any scars. I'm also checking your trachea for any deviation. There's no deviation noted. Do you have any problems with your neck?
No.
Alright, so we're gonna do some range of motions on your neck. Can you move chin to chest, up to ceiling, side to side? Any pain?
No.
Alright. Okay, so now I'm gonna listen to your carotid artery. Can you lay back for me, please?
Yes.
And I'm gonna check that in a 30-degree angle. Alright. No JVD noted. And the other side, no jugular vein distension noted. Alright, so now, again. Alright. No abnormalities noted. Now I'm gonna listen with the bell of my stethoscope. And I'm listening for bruit or switching sound. None? No bruit? Alright. Alright. So now I'm gonna check the lymph nodes. Can you turn to the right and swallow? Turn to the left and swallow. Alright. Okay, Jessica, thank you. Did you have any pain or discomfort when you do that?
No.
Alright, so now I'm gonna look at the shoulders and the arms. Alright, I'm inspecting the shoulders for any swelling, any masses, symmetry, and I don't see any. Do you have any problems with your shoulders?
No.
No? Alright, so I'm gonna check your biceps, and I'm checking down the arms, and I'm looking for swelling. I'm looking for any discomfort. Do you feel any pain?
No.
And warmth. And your skin is nice and warm and dry. No problems reported. Alright, so now we're gonna look at the hand. Alright, so we're looking at the hand and we're inspecting the metacarpals, and we're looking for any swelling, any pain, any discolorations. We don't see any of those. We're gonna check the capillary refill, less than 3 seconds, that's no problem. Do you feel any pain in the hand?
No.
We're looking at the knuckles, and we're looking for any swelling in the joints. And we're looking at the angle of the fingers. No problems, right? No,
Right.
nothing. All right, we're gonna inspect the same way on the other side, and we're looking, comparing sides. Do you feel any pain here?
No.
All right, no pain. Capillary refill is nice and brisk. Now we're gonna check your range of motion of your hands, okay? So now you do like so, and do like this, down, up, open, make fist. All right, do your fingers like this. All right, then now we're gonna do tap, tap, fast as you can. All right, very good, Jessica. All right, so now we're gonna do your chest. All right. Okay, we're gonna do your chest. All right, so we're inspecting the chest, and we don't see any lesions, any mass, any discoloration. The skin color is normal for ethnicity, and we're gonna check the axillary muscles if she's using them. She's not using any axillary muscles. Normal breathing pattern. Okay, so now we're gonna auscultate, which I'm gonna listen with my stethoscope. Okay. All right. So I'm gonna listen with the diaphragm, and I'm gonna listen with the bell. Diaphragm, aortic artery, pulmonic artery, tricuspid, mitral. So while we're here, we're gonna go ahead and listen also to Erb's point. I'm sorry. All right. Now we're gonna go ahead with the bell, and we're gonna do the same thing. So aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. All right, so Jessica, right now, I'm gonna have you roll over to your side. And while we're in this position, we're gonna go ahead and check your apical pulse, okay? We're gonna palpate, and then we're gonna listen for 1 full minute. So, palpate. All right, they can feel it. Now I'm gonna check your apical pulse. All right, your heart rate is 70, and that's normal. All right. So I'm gonna go ahead and just, while I'm here, I'm gonna go ahead and do your back, okay? Inspect your back and palpate. So I don't see any lesions. I don't see any scars. I don't see any abnormalities. All right?
Mm-hmm.
So I'm gonna listen. Take a deep breath. Okay, deep breath. Okay. All right. We're gonna palpate. All right. So I'm gonna put my hands on you, and you just say 99.
Okay.
99 for vibration. Okay.
Okay. 99, 99, 99, 99.
All right. Nice and good. We're gonna do the same thing in the back. Okay.
99, 99, 99, 99.
All right. And while I'm in the back, I'm gonna just check your lung expansion. So take a deep breath. Good job. All right. All right. So for the purpose of this video, we would not expose Jessica for the breast examination, but this is where we will do a breast examination and also axillary inspection and palpation of the axillary. So Jessica, would you put your arm up for me, please, over your head? All right, and I'm looking for Jessica's breast. I'm looking for the contour, the size, the shape. I'm looking for symmetry, and I'm also looking for and inspecting for any drainage, any dryness around the areola. I'm looking for inversion or eversion. And I don't feel any, so I'm gonna go ahead and let Jessica put her arms on the hip, lean forward, and I'm gonna do the same thing at this time. And I don't see any abnormalities. Then Jessica, put your arm on the table, lean forward. Okay, there's nothing. All right, so now we're gonna palpate. And this is what we will do. We will just palpate in circular motions, increasing in intensity. And on both sides, we compare sides. And at this point, we will teach Jessica about self-breast examination. And Jessica, you do know how to do it.
Yes.
Okay, well, you can also do this in vertical, your self-examination also. All right? And then I'm gonna check your axillary. And so you're gonna raise your arm up for me, and I'm gonna palpate. You feel any pain?
No.
No pain? All right. Same way. Any pain?
No.
All right, Jessica, no pain. All right, so what I'm gonna do while I'm here, I'm gonna go ahead and check your inspect your elbows. So I'm looking for any redness or tenderness, any deformities. No redness, no tenderness. Do you have any problems when you bend your elbow? No, no problems.
No.
All right, put your arms like this for me, please. All right, I'm also gonna do the same thing while she's got her arms, elbows bent. I'm palpating for any nodules. There's no nodules. Any pain?
No.
No pain. All right, I'm gonna do resistance. So go ahead and don't let me pull you back. All right, push. All right, we compare sides. All right. Okay, Jessica. So we did that. All right, so then now we're gonna move on to your abdomen.
Okay.
You wanna lay back on me?
Okay.
All right, so I would drape Jessica up, make sure I cover her nicely, just exposing the abdomen. And so I'm inspecting, and I'm inspecting for any lesions, any mass, the shape of her abdomen. And normally for COPD patients, they would have like a barrel chest, and the abdomen would sometimes be distended. Jessica, do you have any problems?
No.
Okay, all right. So, do you have any problems when you urinate?
No.
No? Okay. All right, so I'm gonna listen to your bowel sounds, and then I'm gonna listen for vascular sounds. All right? Did you empty your bladder today?
I did.
All right. All right. All right, and we will go from the right low quadrant and work our way around. So I'm listening with the bell for vowel sounds. All right, her vowel sounds is normal. They're not hypo or hyperactive. They're normal. All right, let's go ahead and just go on and do your vascular sounds. I'm sorry. All right, with the bell, and we're gonna listen to your aortic. Any bruit or switching sounds, and I don't hear any. And then the renal artery, right? And then left artery, the iliac artery. All right, that's normal. Then I'm gonna do the femoral. And femoral, that's normal. All right, so we're gonna go ahead, Jessica, after we listen, and we're just gonna do some palpating.
Okay.
All right? I'm gonna do light palpation, then I'm gonna do some deep one. You let me know if you feel any pain
Okay.
or tenderness, okay? Person, any discomfort?
No.
No? No?
No.
All right, so we're gonna do deep palpation. Any pain?
No.
Any pain?
No.
And I'm also, at this point, I'm feeling for any masses or any lesions, as well as the discomfort. Do you have any pain?
No.
Do you have any problems with your bladder or your belly or
No.
discomfort, any of those things? All right, Jessica. All right, so now we're gonna move on to the hip, right? So I'm checking, can you stand up for me?
Yes.
And I'm checking for any, I'm looking for symmetry. I'm looking for any crepitus. I'm gonna feel for the crepitus. I'm feeling for crepitus. And turn around for me, please. And I'm gonna feel for stability of the hip. All right. You feel any pain when I touch you
No.
like that? All right. So, do you want to go back up and we're gonna check your range of motion for the hip?
Okay.
All right. So, all right. So, and I'm gonna pull this up.
Okay.
All right. So, you wanna raise your feet up? I can help you. All right, Jessica. That's good.
All right.
All right. And Jessica had hip surgery, so I'm not gonna go ahead and let her turn on her side and do all of this abduction thing because it's painful. I'm sorry. I don't want to put you through that. All right. All right. So that's the hip. All right. So now we're going to the lower extremity, and I'm inspecting from the top to the bottom, and I'm looking for any discoloration. I'm looking for hair distribution. I'm looking for any swelling, and I don't see any. Do you have any problems when you walk?
No.
Okay. All right. So, let's go ahead and palpate, and I'm gonna check. I'm checking her knees, palpating her knees. There's no nodules, and I don't see any deformity. Do you have any pain when I touch you? All right. So I'm gonna do the leg. Any pain?
No.
And I don't see any swelling. All right. So now I'm gonna check your pulses.
Okay.
All right. So we're gonna do the popliteal pulses and compare sides. It's normal in strength, rhythm, and rate. All right. So now I'm gonna check your posterior tibial, comparing sides, and that's normal in strength and rate. All right, and then we're gonna do the dorsalis pedis, comparing sides. All right, Jessica, while we're here, I'm gonna look at your ankles and make sure that there's no swelling. Do you have any pain when you walk on
No.
the ankles? I don't see any swelling, resistance, up and down.
Sorry. Miss Haskins?
All right.
No? Haskins. Oh,
All right, so there's no abnormalities noticed there. All right, so I'm gonna stand up for me. All right, Jessica, I'm gonna inspect your cervical spine and your thoracic spine and your lumbar spine. Do you want to for the cervical spine? We're gonna do. Can you turn to the right? Turn to the left. All right. Can you bend over? Touch your toes. All right. And back. Lean back. All right. Any pain?
No.
All right. Any pain when I do this?
No.
All right. Okay. All right. So right now you have a seat. All right. So Jessica, we're coming to the end of our examination. But the last part is the reproductive.
Mhm.
All right, so we're not, for the purpose of this examination, we're not gonna do a reproductive system. But if we were, we would have done her external genitals and the perianal area, and we will also check the inguinal area for any hernias. I think we're gonna do, the last thing we're gonna do is your deep tendon reflexes, and we would be over. All right. Okay, so. All right, so. Biceps, triceps, biceps, triceps, patella. All right. Achilles, we comparing sides, and then we're gonna do plantar or Babinski, and that's normal. And we are done.